Pukeology podcast, where science meets your hilarious puke stories and the tips and tricks to stop that up-chuckle that you need.
You never know what's going to spew out of her mouth. Here's
my mama,
Dr. Pukeology.
What is a VBAC? I thought there were only two types of deliveries. Well, I'm here to teach you all about what to expect on your birthday. From vaginal deliveries, C-sections, to VBAC. So you'll welcome your beautiful baby and know exactly what to expect in today's version of Pregnancy Pukeology Podcast, Episode 21, What is a VBAC? And a VBAC versus a cesarean. Want no more morning sickness, pregnancy nausea, delivery vomit, or how about no more headaches or migraines? Visit your sponsor, nomonausea.com, the only natural way to instantly stop your worst nausea, vomiting, or headaches now. Or just place the No More Nausea ban on your baby registry for your delivery bag at Bye Bye Baby, or get it shipped in only 2 days for free on Amazon as a Prime vendor. And we always take care of your little ones too with No More Nausea Kids, now available at your local CVS and Long's health food store. We got some pregnancy humor that may just make you want to pee your pants, like you don't have to pee all the time anyway, with hilarious stories like ATM stands for ASS to mouth, is what I mean, picnic poison, and high five for no puke. If you want to learn more about your pregnancy, humor and knowledge is the key to help you survive these 9 months. And just know we're in this together. Today, you will learn the science behind what a VBAC actually is, the result when it is performed successfully, and complications that could potentially arise which could lead to having you have a C-section. Remember, your birth plan doesn't always go as planned, and babies will come whenever they're ready, unless helped by modern medicine, of course. So here are the 5 most helpful tips to anticipate your unexpected delivery with grace.
The science of puke, Pukeology.
Most mothers are aware that there's really only 2 places that babies come from, either through the vagina, called a vaginal delivery, or through your tummy, which is a man-made incision that's called a cesarean section. When I was pregnant with my daughter, my son, who was about 4 at the time, would look down every time I was on the toilet and said, "Is she coming yet?" I gave him the anatomy lesson that babies come from the vagina. I had an emergency C-section, so when he came in to visit me, I said, "Oh baby, my tummy hurts. That's where Mia came out of, so do me a favor and don't jump on my stomach." He looked at me with a snarl and said, at 4, may I tell you, "You lied to me. You told me that babies come from your vagina, but I told you babies come from your belly button." We all laughed because of the fact that my son still believed that babies came from the stomach, and because I ended up having a section, he was actually right. So I vowed to disclose that there are always 2 different ways the babies will come out, either man-made or naturally through the vagina. A VBAC is an acronym for vaginal birth after cesarean section. If you actually deliver vaginally after you've had a C-section, that's what's called a VBAC. But if you undergo a trial of labor after a cesarean delivery, it's called a TOLAC. So there is a difference. If you were successful and you actually delivered through the vagina after you had that C-section, that's what's considered a VBAC. Let's say for some reason you had to have a cesarean section, C-section for short, on a prior pregnancy. Mine was because my beautiful daughter was frank breech. So I'm going to break down that word. Breech just means that she was flipped around, so not head down. And then frank actually means where she's kind of like folded like a pike sit with her butt on my cervix. So literally she was coming out of my cervix the wrong way. So that was an emergency procedure where I had to have a C-section because you can't come out that way. She would have broken both of her hips. Now, I have to say that I loved my first vaginal birth. It was with my son. My abs were in shape. I literally pushed for 15 minutes, didn't tear, and was up getting food and making food for my family members within minutes of having my beautiful baby boy. That was not the same when I had a C-section. Remember, ladies, a C-section is a major surgery. So I was cut from one side of my abdomen to another. I do have a beautiful C-section scar because you can't even tell it. So I can still wear a bikini. But the rule is once you have a C-section, or the old rule I should say, once you have a C-section, you always have a C-section. That's been recently kind of thrown out with this concept of VBAC, which has been done for years. The reason why is when you have a C-section, your muscles are cut. Remember, ladies, your uterus is also a muscle too. That's what grows and it houses the baby, and then it shrinks back down when you're no longer pregnant. It's also, what squeezes the blood out when you're having your period. But again, being cut open as a C-section, most OBGYNs would recommend that you have another C-section or more C-sections thereafter, only because of the fact that we would never want your uterus to rupture during labor. That causes an intense amount of bleeding. You could potentially end up losing your uterus because of the fact that we would have to save your life. So again, we would have to preserve the amount of blood flow. Now, I told you how awesome my first vaginal birth was. So if I were to get pregnant again, I would actually opt for a VBAC just because of the fact that I fit the criteria. So let's kind of go into what the science is behind it. So 60 to 80% of women who attempt a VBAC are successful, but not every OBGYN is comfortable. So please make sure that this is a question you discuss before you choose your group or midwife or whatever that may be, to even see if you are a candidate for a VBAC. I am a perfect example of a candidate that is a VBAC candidate. So let's go through all of the different qualifications. Number one, am I a good candidate for VBAC? Well, number one, if you've had a prior vaginal delivery, check, yes, I have. Number two, are you 35 years or younger? If you don't have that advanced maternal age sticker on your chart, which happens at 35, ladies, a 2007 study found that younger women actually had a better success rate and less complications with a VBAC than those who were older. Number three, horizontal or a low traverse uterine incision. Big word warning, Pfannenstiel incision, yes, and that's actually spelled with the PH. That is actually the horizontal low uterine cut. Now, if you had one like that, that's okay. So you have a better chance of having a VBAC on this next one. The reason why you had a C-section was also the fourth reason, and it was due to a repetitive indication, meaning that a C-section was performed for the baby's health and not because of the process. Like my daughter, she was a breached baby, or if she had some abnormal fetal heart rate tracing. That's all because of the baby is the reason why we had to take them out, not because, let's say, your pelvis was too small or other different types of complications that would happen as an indication for why you couldn't deliver vaginally. VBACs are not recommended, or the chances are high risk when the following aspects. Number one, a vertical T-shape incision. Usually this is done in emergency situations where they need more room to get the baby out. So they make the incision larger. It basically puts a T from your pelvis to your pelvis and then bring it up to the actual belly button. You're at a greater risk for uterine rupture if you do try a VBAC after that. Labor dystonia, again, abnormally slow or difficult labor. So why tempt fate? Why tempt it? Just be safe and get another C-section. Health complications. Do you have heart or lung defects? If you do, it is just not safe to chance it. Multiple C-sections. The C-section limit is usually 3 or 4 sections. I don't know any OBGYN that would touch you after 4 and try a VBAC, to be honest with you. Large babies. If you have macrosomia, which means large baby, again, this is babies that are greater than 10 pounds or have had severe gestational diabetes, because babies with moms that have diabetes are huge. If you went past your due date, again, going over 40 weeks, it's just not safe again, mainly due to the part that you're going to deliver a huge baby and you might not be able to get the watermelon out vaginally. Home birth. The ACOG meeting is an obstetric practice that considers fetal malpresentation, which means like any position not head down, multiple gestations, or prior cesarean delivery, an absolute contraindication to a planned home birth. So if you are planning a home birth and you have already had a C-section before, don't try to deliver at home. Again, it's just not safe for you. It's not safe for the baby. Remember, the last thing in the world you want is your child to grow up without a mother. So it's very important that you take those precautions. Now, again, if you want to find out if you have or at a good risk and or if you are a better candidate for a VBAC, go to these VBAC calculators. There's a bunch of them out there. My personal favorite, it's called perinatalquality.org. And it actually has a VBAC calculator that you will see. So I'll give you the full email or the full address. It's www.perinatal, that's perinatal, quality, all one word, QUALITY.org, ORG/WF VBAC, that's VBAC, and then calculator, CALULATOR.SPX. Go over there, check it out, and see if you are a candidate for a VBAC.
Throwing up on a Tuesday? One puke story.
I pushed so hard during my delivery that shit flew out of my butt right into my husband's mouth when he was taking a peek at our beautiful daughter that was just being born. I shit in his mouth and all over his face. He instantly started throwing up, and I'm a person who pukes when other people puke. So the demons came out from top and bottom, and every time I heaved, it made me shit more. He moved out of the way. Our lovely twins are all good, but that was not the last time that either one of us have had poop in our mouth. Thanks, hipster in disguise, for your hilarious puke story. I giggled my face off when I read this one, so I had to put it in there. Number 2, a couple months ago, I was about 6 weeks along, I threw up in the shower because I thought about the coleslaw from the previous day's picnic. I don't know what's wrong with me or my body, but I don't think I ever want to be Yogi Bear and eat another coleslaw and or picnic food again. It makes me hurl just typing this. Thanks, Starbuckles, for that hilarious puke story. I have to say, remember, you're not supposed to be eating those type of processed items anyway, so it's probably in your best interest is why that you got sick thinking about it. Number 3, strangely enough, every time I thought, wow, I've gone so many days without puking, woo! And then that was the day again that I started throwing up. Just the thought of not throwing up makes me throw up. What's wrong with me? Thank you to Potato Chippy 91. There's nothing wrong with you, Mama. You are just pregnant. And let me tell you, unfortunately, that nausea will sneak up. So go visit nomonausea.com and you'll get a band that will help you to stop doing that as soon as you start getting the feeling or sensation. Do you have a hilarious pregnancy puke story that you just can't wait to share with me? Send it to me. Pukeology at nomonausea.com. That's Pukeology at nomonausea.com. Or tweet us at Pukeology so we can all have a crazy laugh.
Tips and tricks to stop the up-chuckle that you need.
Increase your chances of having a successful VBAC by doing a few things. So I'm going to guide you through some tips that are actually helpful for you if you are dead set and determined to have a VBAC after you've had a cesarean section. Number 1, talk with your doctor early in the pregnancy about having one and make sure that they are comfortable doing them. Ask them point blank, how many has your group done and how many of them are actually successful? Remember, the average rate is right around 60 to 80% successful. So if the OBGYN group is a newer group and hasn't done very many, I would highly suggest taking a look at other groups that may be much more specific for difficult types of deliveries. Manage your weight, ladies. You can do this by staying active. You don't have to go run a marathon while you're pregnant, of course. You can do this by being in the pool, doing water type of aerobics, walking around the block. A study in 2013 showed that overweight women who lost just one body mass index point increased their chances of having a successful VBAC by 12%. So run over and listen to episode 12. How to maintain, or what is the perfect pregnancy weight, to find out exactly how much weight you should be gaining and or losing during your pregnancy. Let it go. Wow. Frozen teaches us so much. And if you don't even know what that is because you are a new mom, I'm going to let you know that you will find out very soon because Frozen's going to be coming out with another movie. So let it go. By that I mean, let Mother Nature run its course. Your chances for a successful VBAC increases when you go into labor on your own. The average uterine rupture during a VBAC is 0.7% versus 1% if you're induced with Pitocin or 1.8% with prostaglandins. More of the story is let nature run its course and let it go. Now, having a successful delivery depends also on a few different items. Regardless if you're going to have a vaginal birth, a C-section, whether it's scheduled, or the baby just decided to come early or late, here are a few tips coming from a mom myself that I can help you in having the best delivery you can possibly have. Plan to the best of your ability. Now, I'm a super planner, so babies don't come on your time frame, just FYI. Try to ask off work, though, for at least a week of your delivery date. That may need to be moved sooner or later. Did you know that only 5% of women actually deliver on their due date? Keep in mind that at 36 weeks, your baby is considered full term. So if you have the blessing that your spouse works, for example, and that you're able to take off for a month, go for it because you have a higher chance of delivering any time during that month. Now, 37 weeks is when most OBs will consider doing a version. That means that a baby that is breached, like my daughter, would literally be flipped around so that they're head down so that you could end up delivering as a normal vaginal birth. The reason why is because a version, you have to have an actual OR ready to go, and you do this in the hospital. Now, you cannot have a version or a flipping of the baby if you have an anterior placenta. An anterior placenta actually means that your placenta is in the front, and again, we don't want any type of breaks or tears, so they won't even attempt it if that's the case. But if it is successful, that's great. You end up having a vaginal delivery. If it's not successful and some complications arise or the baby doesn't like it and the baby's heart rate goes down, you will be rushed for an emergency C-section. And they want to do that at 37 weeks when, number one, the baby's not as large, and number two, it is still considered full term. The last month of your pregnancy, you will go see a doctor about every week. It's good to ask off of work for the exact same day every week so that it's easier to plan. If you make it to 39 weeks, it's literally like every other day. If you have a perinatologist, you will already be very accustomed to seeing your physicians all the time. I think I was up to like 3 times in 1 week, every single week for the last month, to be honest with you. So again, if you had other complications with a pregnancy before, they're going to keep a closer eye on you. Make sure you keep puppy training pads in your car and on your bed, just in case your water breaks. Trust me, you can't get that stuff cleaned out. And remember, you're not going to replace your car and your mattress when you get home after you have a baby. So again, that's just a lot of cleaning to do, and you really don't want to. Make sure that you make the drive to the hospital with your spouse because you don't want to be lost in the heat of the moment when you're contracting away. It's just not a good move. So make sure that you plan ahead and that you try to actually map out that route and see how long it takes you too, because that'll determine how soon you need to go to the hospital during your contractions. A hospital bag should be packed and ready to go. You need the following items. Take out a pen and paper and write these down. Number 1, a big squirt bottle. Think of like those Gatorade things that the sports teams use that has like the nozzle. This is to put hot water in. So when you pee after birth, it helps so that there's no burning. You guys, regardless if you had a C-section or a vaginal delivery, you will be bleeding out of your vagina. I'm going to say that again because a lot of people don't know that. If you had a C-section or a vaginal delivery, you will be bleeding out of your vagina, and there is a lot of pain and discomfort because the whole area has been engorged. So make sure you have a nice big squirt bottle so that you can clean up while you're actually peeing and or when you're pooping. It will help to relax the sphincter. Comfortable socks with traction. You need to start walking ASAP on the floor, okay? Movement is always good to get everything going, especially if you've had a C-section, but you don't want to slip and fall. So make sure that it has some sort of traction. Think of those trampoline jumping places, the socks that they would use there. PJs that are very comfortable and have easy boob access if you plan on breastfeeding. I personally love V-shaped ones or ones that are just spaghetti strapped. You literally pop it down, put the baby on, and you're ready to go. You're an easy access milking machine. Pack some nipple cream and a nipple shield if you had trouble with breastfeeding on the first baby or a baby before. So remember, breastfeeding is the most unnatural, natural thing that I've ever done. And by the way, my husband has never sucked on my nipples so bad to where I get completely raw and or mastitis. So make sure that you have nipple cream and that you have a nipple shield if you really do want to try to breastfeed. A nipple shield is just kind of like the top of a bottle so that the baby can latch a little bit better to your nipples that might not be fully out. A breastfeeding pillow. There's a whole bunch of good ones. I personally was a fan of the Boppy, but that's just me. A tennis ball for back aches so that you can rub it out. So again, you can always put it on your bed and move up and down, or tell your wonderful hubby to rub it up and down also. And then you need a change of clothes, okay, for both you and the baby to go home. Ladies, don't pack something that is not maternity wear. You will still be swollen. You just had a baby, and even though you have that part of the baby out, you're still going to be massively swollen with extra edema. Most of the time, most of us leave the hospital are right around the same amount of weight. So again, just bring your pregnancy clothes. It'll make you feel better. Don't try to stuff yourself into something else. And of course, a no-mo nausea band to help stop nausea and vomiting during delivery. Throw it in your bag, put it on your baby registry at Bye Bye Baby. Do something for yourself. Everybody else is going to bring you gifts for the baby. Buy yourself a gift for you. So you probably will puke. Be prepared. Over 80% of women have nausea and vomiting during delivery, both in a C-section, and a C-section is usually due to the spinal anesthetic that they will place will drop your blood pressure and or any type of pain medications. And if you're inadequately hydrated, meaning that you're just dehydrated, you will probably puke. Again, your anesthesia provider will give you medication to increase your blood pressure, but you'll still get the nausea and potential vomiting. Now, during the actual tugging and pulling of the baby and the pressure, this is what we call a vasovagal response. A vasovagal response also happens when you deliver vaginally because you're literally grunting to get the baby out. That can drop your heart rate and increase your response to want to vomit. It's a natural response. It's a reflex. We all have it. We all do it. 80% of us will puke. So run over, go to Amazon, go to Walmart.com, go to CVS, wherever it is that you need to go to, but purchase a no-menage-a-band. You can throw it in inside of your hospital bag. It goes seamlessly into the delivery room. And again, 28 hospital systems around the country actually have this product to make sure that their moms are safe and comfortable during a C-section, during delivery, and then of course after, just in case they had to have a C-section or had to go completely off to sleep during their C-section because of a true emergency. All it is essential oil in combination with acupressure. So remember, there's nothing scary about it. There's no side effects, and it helps to stop over 80% of people from not getting the upset tummy that you do get. Meet everyone that you possibly can that could potentially deliver your baby before you show up to a hospital. Your favorite OBGYN might not be, or most likely won't be, the actual person who's delivering your baby. It always happens to me. Your favorite doctor is always on vacation. Happened twice when your little baby decides to come into the world. So make sure that you meet all of the rest of the partners in the group, because you never know who you're going to be stuck with at 2 o'clock in the morning when you come into emergency triage. Don't be so close-minded, and ask all of the questions about anesthesia during pre-op. So when you have a nice level head, remember, anesthesia is not the bad guy or girl. It's actually one of the world's most important advancements in medicine. Even if you don't want an epidural, discuss it. Talk with them about the length of a procedure, how it's performed, how many anesthesia providers are on the floor. That makes a big difference to see whether or not what that time frame is if you change your mind to have a epidural, for example. And then what types of medications that can be added to an epidural or a spinal, so that if you don't want that numb feeling because you didn't feel like you could contract perfectly, you can be given pain medication through an epidural. But if you don't have one and you choose one too late, unfortunately, sometimes babies just come. And I know me personally, I would never want to have a watermelon-sized child come out of my vagina without some sort of pain relief. I will have to say that a spinal and an epidural is very different. An epidural is usually what they place on the floor. You have to have higher concentrations of the medications, and you're not completely numb. You can still push, but again, sometimes it's hard for you to feel the difference because you are a little numb and tingly. You'll still be able to move your legs though, and things of that nature. So I would suggest asking them for a mirror, or bring your own little mirror to see which muscles in your pelvic region you are adequately moving. If for some chance you have to have an emergency situation, having an epidural is very safe. The reason why I say that is because they can literally put a high concentration of local anesthetic and then numb you completely from your tummy all the way down so that you can present for a C-section in a blink of an eye, versus having to go completely off to sleep under a general anesthesia, which means you would have to have a respiratory tube, they would have a machine that would be breathing for you, and you would completely miss the birth of your baby. So there are many different reasons why a epidural is safe, and you want that to happen. And me personally, if I'm a baby that's literally been sloshed around, whether you get medication inside of your IV or whether you get an epidural, the baby has a very small chance of getting a little bit. But if I'm coming down the canal and I'm getting squeezed through and I'm being ripped out of my hot tub, I might want a little bit of pain medication anyway. So think of it like that. Think of it as you helping not just yourself, but also your baby. Another thing is, if you do have a vaginal delivery and this baby gives you a tear, splits you from your vagina to your butthole, you have a higher chance of having to have an epidural in place. You will have to have one placed anyway, but that's for the pain whenever they're suturing you back up. You no longer will have those endorphins, that release of these hormones when you're delivering, so you probably will feel it even more so. Yes, local anesthetic can be given to your perineum or the region in between, but it's already filleted open. Again, I love epidurals. I love anesthesia. I just think that more questions should be asked about anesthesia so that you can, with a level head, talk about it with you and your partner to see if that's the safety measure or precaution that you're ready to use. Now, another is if you are having a VBAC, I'm going to stress this again just for your safety, get an epidural. Again, if you have to go to an emergent situation, you want to be able to do what's best for you and for the baby. When you have a spinal, which means where they place it in directly into your cerebral spinal fluid, your CSF, which is that clear fluid that bathes your brain and your spinal cord, you actually use less medications. It is a smaller needle than an epidural, but you will be completely numb from the top of your stomach all the way down to your feet. Like, you cannot move your feet at all. You will still feel touch and pressure, but no pain, because the local anesthetics will knock out completely what's called the mu receptor or the pain receptor. And again, this makes it a surgical possibility to be able to have a C-section. So that is a complete 100%. You will be numb from top to bottom. That's what a true spinal is. That's what's usually used if you don't already have an epidural for converting to a C-section. It's important to know your options. Talk to your anesthesia provider, go to the hospital, have a pre-op, talk to them, because they literally have your life in their hands. And it is very important that you feel comfortable and you make a decision with a rational mind, because once that baby comes and those contractions, they are kind of like a bulldozer. You just never know what you may or may not try to decide. Most deliveries are a marathon and not a sprint. Make sure you bring your phone, a good movie or two to watch, a speaker for some music, and your support system in the room. And get excited to meet your beautiful baby. Now you know what a VBAC is, how it differs from traditional vaginal delivery, and why the myth is busted: once a C-section, always a C-section. Our guide to a successful VBAC and tips for a happy delivery will give you the answers for the best information about pregnancy deliveries that there are to date. If you love Pregnancy Pukeology podcast and me, Dr. Pukenomo, let me know with a 5-star rating or hearts for likes. Don't forget to download this episode, but more importantly, share it with all your prego friends. Thanks for listening to Pukeology podcast in Pregnancy episode 21, What is a VBAC versus a Cesarean section? Thanks, guys. Can't wait to have you guys listen to next Pukeology Pregnancy podcast.
Pukeology Podcast, edutainment at its finest.